My grandmother told me once one of the most important things I've ever heard, which was, if you want somebody to like you, you have to like them first. And I come in every day and I like each of my patients. I think any patient that comes to see me can expect that they're going to be treated with dignity and respect, that I'm going to listen to them, that my team's going to listen to them, that it's going to be fine, to set expectations, to say, look, yes, you have a stress injury of your leg. That's tough. But I'll tell you a few things. You know, the Division I athletes and the pro athletes, every single one of them has been through this. I've never met one that hasn't. And here's what to expect. You know, we'll get you back stronger. While you're hurt, we'll keep you in good shape. We'll keep you on a bike. We understand what it is you want. We understand what your family wants. We understand the pressures. We understand the sadness of not being who you define yourself by. If you're an injured athlete, if you have a stomach problem as an athlete that's getting in the way of your sport, if you have issues with diabetes in sport, we'll see you. We'll see you for everything. But most of what we see is musculoskeletal. And so we take care of everything: elbows, knees, shoulders, hips, necks, head. We have a concussion group now that sees emergent concussion issues. And we involve our teams throughout the hospital. And if I can't take care of it, and if it's not something that I am a specialist in or that I have seen a million times, then we pass it along to somebody who has. We don't want anybody to have to wait and be anxious and not know what's going on. So we see people quickly. That we're growing a group that sees people quickly for anything. Emergency sports medicine, we want you to be able to come, be seen, most times, 90% of the time, get your treatment, know what's going on, and then in 10% of the time, get you to the right person. And we don't want them to linger with an injury that might have been just something easy to manage because they're worried either about it taking a long time or being told they're out of the game unnecessarily. And so I think what this group brings is confidence to all of our athletes and all their friends that if they come here, they're going to get good care, they're going to be listened to, and they're not going to be taken out or put back in without their involvement. I think one of the things that is hardest for us is to hear that patients can't get in to be seen. So we always have a team here that wants to take care of athletes and wants to see them succeed. And we all want them to look back on our institution and say, that was the reason I went there, is because they took care of me and I could trust them. And I think that being cutting edge in every regard doesn't hurt.